Over the course of 6 years, I've travelled across the UK, uncovering documents and speaking to families. People all connected by one thing. The drug Primodos was used as a pregnancy test, but did it actually deform or even lead to the death of children?
I'm convinced, and I will be to my dying day, that that this drug was responsible for the death of my child.
I hope that in my mother's lifetime she will get to know the truth.
After decades with little information, a new government-commissioned report into the effects of this drug has now been released. Will it provide the answers?
I mean, would you recommend the use of this as a hormone pregnancy test today? You wouldn't? No, well, I wouldn't.
I've got a very shortened tongue. Part of my gum missing.
Very good.
I have one eye that doesn't really work at all. There's obviously the arms. Then my feet, when I was born, were very much folded inwards. I'm missing the big toe on either foot, so I have 4 toes on each foot. This is the copy of the medical records that my mother has from the GP, which clearly shows Primodos was prescribed on the 26th, we think that is, of the first 70.
When Daniel was born, his parents suspected Primodos was the cause of his problems. But medical professionals told them his malformations were just an unfortunate fact of life. Only this year, after watching a Sky News documentary, did Daniel realise there was a whole group of people who believe Primodos may have caused deformities to themselves or their children. People such as Mary Lyon, the chair of the Association for Children Damaged by Hormone Pregnancy Tests. Her daughter was born with a shortened limb. Jeanette Dean's child died shortly after her birth. Medical records described her daughter as a monster child.
It's incredibly powerful to be sat in a room with that number of people who've been so savagely affected in their lives. Children have died. This is fundamental stuff.
For more than 40 years, these families have sought answers. Now, the long-awaited findings of a government report have been published. It finds there is not the scientific evidence to support a causal association. Despite this warning on the packet in 1975 that it could cause malformations, the evidence isn't strong enough to prove a link. But campaigners who met with the MHRA today said the experts were asked in the terms of reference to find whether there was a possible link, and they haven't answered that question.
I just think it's an absolute betrayal. I felt that the meeting we've just had was patronising. It was designed basically to justify the conclusions that they've made. And the conclusions they've made is actually on a causal link, which I just cannot believe. The terms of reference are absolutely specific, that what they're looking for or should be looking for is a possible association.
Did they say whether they'd found a possible association?
No, they've not looked for it.
Was there a possible association?
Well, that word was chosen particularly because we entered this group with very open minds about it. We didn't prejudge the issue. We were looking, was there an effect, was there not an effect?
But with an open mind, can you answer that question? Was there a possible association?
Well, we have, from our studies, which have looked at all the available evidence extensively, thousands and thousands of data from around the country, published and unpublished information, we did not demonstrate a causal association.
But a possible association?
The possible associations when we started, and we were open-minded at whether there was any association or not, and then the result of our expert group was not to find any causal association.
But I'm just interested, you're not willing to say whether there's a possible association or not?
Well, medicine is always uncertainty, and if any new evidence was to arise, we would certainly be happy to look at that.
There might be a reason why the report authors won't answer that question. If you look at the document they released today, it says October 2017, and that's because it was due to be released last month, but they pulled the press conference at the last minute. But we have a draft copy of the original report. Now, they may not have changed the date, but they have made some significant changes inside. In the original copy, they say the limitations of the methodology of the time and the relative scarcity of evidence means it's not possible to reach a definitive conclusion. This sentence has been removed. Another thing that's disappeared from draft to final copy is this graph. It shows that of human studies into hormone pregnancy tests, 8 out of 12 favour an association between the use of the drug and malformations.
The fact that the report didn't have the right date on the wrong month, that clearly had been adjusted from what had been presented last month to what is so-called the final draft this month, that does not give any credence to the credibility of what's written there.
In the body of the final report, human studies into specific conditions and their relation to women taking the drug appear to be concerning. Of 15 into heart defects, 11 favour an association with the drug. All 5 of the studies on limb reduction do the same. But today's report authors say even those showing a statistically significant increased risk used outdated methods and therefore could overstate the association. But other experts disagree.
Actually, it's quite possible that the causality could be greater than it is less. I mean, it could be at least as possible, if not more possible, that the causal link is greater than the weak link that those studies demonstrate because of their lack of capability to detect it.
On animal studies, the report authors have chosen not to give consideration to the most up-to-date study conducted this year in Aberdeen on fish embryos, because they say it's yet to be peer-reviewed. Here the findings have been alarming.
And some of the problems that we found were things like enlarged hearts, changes to the yolk sac of the embryo. The yolk sac contains nutrients, so allows the embryo to grow, twisted spines.
Compare this normal embryo to one where the drug has been administered in early stages of development. A shortened tail, diminished yolk sac, no eyes. The earlier the drug's given, the more extensive the damage.
And we also have fin defects. So you see the fins here away from the body, and you can see here that they're damaged. Evolutionarily, the fins of the fish gave rise to the limbs in us.
Many have waited decades for answers about this drug, and the peer review on the Aberdeen fish study is due in a matter of days. So it's odd that it's been excluded, especially considering today's report uses 44 other non-peer-reviewed studies. Many of them were produced by the manufacturer. The makers of Primodos shearing, now owned by Bayer, has released to the MHRA some of the animal studies conducted just after the drug was taken off the market. In 1979, the compound was given to mice, and examination of embryos reported a significant increase in visceral malformations, including the heart, lung and thorax wall, at a high dose. On this, the authors conclude the increase in malformations in this study should be considered drug-related.
I think some of the animal studies that they refer to in their report suggest that there is a link. But clearly we need to do more work. I mean, would you recommend the use of this as a hormone pregnancy test today? You wouldn't? Oh, well, I wouldn't.
Some of the other animal studies don't appear to show a link, and regulators conclude that overall they use outdated methods and are inconclusive.
I mean, I think it's indisputable that there's an association. I might also say MHRA and their predecessor organisation were the regulators, and so I think they're being defensive. I'm not sure they were the right people to put in charge of a piece of work like this.
So what does this report tell us about regulatory failings? The report authors have explicitly decided not to examine how the drug was regulated. Earlier this year, Sky News travelled to Berlin. In National Archives, we uncovered documents showing worrying behaviour by UK regulators. One of them warned the manufacturers that women who used Primodos had a 5-to-1 risk of giving birth to a child with a malformation. But documents suggest the man working for the Committee on Safety of Medicines destroyed all the material on which his investigation was based, and he'd done that to prevent individual claims being based on his material.
It's something out of a spy story almost, isn't it? It's one can't really quite believe the level of collusion and abuse of trust, I think.
Many experts we've spoken to say regulators should have been the key focus of today's report.
Ultimately, what we want to know is, did the regulator do a good job in looking after people at the time? And I don't know exactly how that question might be asked. I'd like it if that question...
It's not answered in this report.
It's explicitly excluded in this report.
Shouldn't you be looking at the way it was regulated?
Our group was a group of scientists and clinicians who had particular expertise to look at the evidence. We were particularly not asked to do any review of the regulatory issues around the time. Medicines have moved on hugely, and regulation of medicines particularly. We're now in a very different environment. That was not our remit.
So nor can you say whether there were any regulatory failings?
We did not consider that. We're a group of scientists and experts who looked at the science.
But you're asked to draw lessons of safety issues and communication. Isn't that regulation?
This is a very forward-looking report, and we have made at least 13 recommendations which we have tasked the MHRA, our drug regulators, to take forward.
But campaigners say past mistakes should be exposed.
People in authority did know that there was a connection and chose to not to do anything about it. And the MHR has completely not looked at them either. So I don't honestly know what the hell they spent all those weeks and months doing, because they did not look at the evidence that was available.
The pharmaceutical company Bayer notes that a review by an independent expert working group on hormone pregnancy tests of the Commission on Human Medicines has found, consistent with Bayer's view, based on all available data, that the scientific evidence does not support a causal association between the use of hormone pregnancy tests such as Primodos and birth defects or miscarriage.
We found new evidence to suggest they did.
Since our documentary was shown in Parliament earlier this year, the campaign group has swelled. More than 100 MPs, including Cabinet and Shadow Cabinet members, have now joined a cross-party group, which Sky News understands is demanding an investigation into the regulator and insisting the onus is now on the government to get to the truth.
In the body of this report, there is evidence that supports the claims of some of these campaigners, human studies and animal studies that point towards a link. The working group says that they can't find a causal association, but neither can they say that this drug was safe.
For more than 40 years, they've looked for answers, and during that time, the manufacturer has always been given the benefit of the doubt. That just happened again.